I'm going to walk you through the external anatomy of the uterus. So first we need to know what is the anterior and the posterior side. This side looks bumpy and it's raised, and if you look at the other side, it looks more flattened. And so in the human body, this is going to be the posterior side and this is the anterior side, and the uterus is going to sit on top of or posterior to the bladder, and so my glove would denote the urinary bladder. So when we look at the uterus and we see it from the posterior angle, we see there are two ovaries here. The ovary to my right is the right ovary, and the ovary to my left is the left ovary. And this is because we are looking at the uterus from the posterior view. So this structure here, if you feel it, this is the cervix. It's really tough and it's very muscular, and as you keep feeling your way up, you will see that it becomes softer, and that's the beginning of the uterus, and this is the cervix. So we see the uterus and the cervix and the ovaries, which you see here, they're all connected to this broad ligament. So this is the broad ligament, and if you notice, the ovary is connected to the broad ligament by this ovarian ligament here. And I just want to point out the other ovary here, and this is the ovarian ligament as well. Now as you move up the uterine body, you see that it's a bicornuate uterus. There are two uterine horns, and as you follow along the uterine horn, we see that it leads to the fallopian tube, which contains these finger-like projections called fimbriae, and these have an undulatory motion which will allow the collection of the oocyte once the ovulation occurs, and then the oocyte would travel down the fallopian tube, and that is where the fertilization will take place, and then the fertilized embryo would migrate down and it would get implanted in the uterus. So that is the external anatomy of the uterus. So now I'm going to show you how to remove the ovary from the broad ligament. Now if you notice here, this is the ovarian ligament. I'm just going to snip at it here. And I just cut away the ovary. And you have the ovary. You can do the same thing to the other side as well. Notice that the two ovaries have different sizes. This one is larger than the other one because one is the more dominant one. And so I'm going to show you how to do a coronal cut on the ovary. Notice that I'm going to secure the ovary with my forceps, and I'm going to do a coronal cut like this. Because my blade is shorter than the ovary, I need to go pass through a couple of times. Alright. Now when I open up, going to use the scissors to complete this dissection. Okay, now here you see that this yellow structure is the corpus luteum, and this corpus luteum is what produces progesterone during pregnancy to maintain pregnancy. And how this corpus luteum is formed is, it is after ovulation happens and the follicle releases the oocyte, it undergoes structural changes where it accumulates substances like cholesterol, and it becomes this gland which produces hormones. And the main hormone we're interested in is progesterone, which is produced during pregnancy. And in case pregnancy does not occur, then this structure will just will disintegrate and be absorbed back into the ovary. And this is a tertiary follicle because it is visible by the naked eye. And I want to show you another pre-cut ovary. Here you can also observe tertiary follicles, and here are some smaller follicles. So now I'm going to cut into the cervix. Alright, so now I'm going to show you what the cervix looks like when you cut it open. And cutting open the cervix requires a bit of effort because it is a very muscular structure. And what you observe here are the cervical rings. And this innermost ring is called the internal os, and the internal os opens into the uterus, whereas the outermost ring is the external os, which will open out into the vagina. And here you cannot see the vagina because it's been cut very close to that. And so these cervical rings, as you notice, they are extremely tough and muscular, and they also produce mucus. And the mucus acts as a barrier and prevents any sort of infection or bacteria from infiltrating into the fetus. And these cervical rings also provide mechanical support and bear the weight of the fetus as it is developing during pregnancy. And if you look further inside the walls of the uterus, you see there are these little bumps called caruncles, which are points of attachment for the embryo during pregnancy, and then it can develop into the fetus. Now we're going to look at the anatomy of the sheep testes, and you see that the sheep testes is housed inside the scrotal sac, and my hand is indicative of the scrotal sac. And this is the spermatic cord, which is going to suspend the testes into the scrotal sac. Now this outermost layer here is the tunica vaginalis, and it's an extension of the peritoneal layer, and it descends into the scrotal sac. So in this specimen here, we have removed the outer layer of the tunica vaginalis. As you can see here, we've just removed it, and notice that this the inner part of this tunica vaginalis is pretty smooth. So this is the parietal layer, and this is also smooth. This is the visceral layer of the tunica vaginalis. It's not very visible here, but it is going to extend inward into the testes as septae, and it's connective tissue, and that's what you see here. It's going to form a connective tissue, and these septae will divide the testes into various lobules, and inside these lobules you find the seminiferous tubules, which are the basic functional unit of the testes, and that's where spermatogenesis takes place. Now if you look at the structure of the testes after removing the tunica vaginalis, you will notice that there is a C-shaped structure. See the C-shaped structure? This is the epididymis, and this is found in the posterior part of the testes. So this is the anterior side, this is the posterior side. And the significance of this epididymis is that the immature sperm which are formed in the seminiferous tubules, they are going to travel up into the head of the epididymis, so this is the head of the epididymis, and they will travel down through the body of the epididymis and down to the tail all the way, tail of the epididymis. And if you notice, this tail of the epididymis is connected to another structure called the vas deferens, and that is going to be the duct which carries the sperm into the ejaculate. So this is going to lead all the way to the ejaculatory duct. Now you will notice that this vas deferens is connected to this other structure here, and all of this together forms the spermatic cord. Now if you do a cut across the spermatic cord, you will see that in addition to the vas deferens, there are a number of blood vessels seen here. You have arteries, veins, there's nerves, and there's also lymphatic vessels which pass through the spermatic cord. And so that concludes our dissection of the testes.